Douek from France. So we're going now virtually to France.
Hello, Ioan.
And good evening, Pascal. I appreciate that you come so late on a Saturday evening. So Pascal Douek is a medical doctor. She specialized in sport medicine, nutrition, and longevity. He's promoting actively lifestyle medicine in France through his activity, also like a blogger, radio host, author. And you published three books.
Yes, three, but two on longevity.
Yes, two on longevity. They are really nice books. So I invite for those who are speaking French to read the books, because you are really, I would say, really reference lifestyle medicine books from the longevity perspective in France. So welcome, Pascal.
Okay, thank you, Ioan. So I'm sharing my screen. Hope it works. Does it work for you?
Yes, we see it.
Okay.
And just to make bigger,
Yes.
Okay, perfect.
Okay. So you said medicine, Ioan, but I'm a medical doctor, as you said, nutritionist, micronutritionist, a specialist in sports medicine, and I've been one of the first medical doctors graduate in longevity in France. It was in 2018. So it's longevity science. It's something very brand new in France. And there is a little number of doctors who start to practice the lifestyle medicine, but we are at the very beginning. I spent all my career in healthcare advertising agency, where I work on many prevention campaigns in the objective to modify the lifestyle habits of the public or of the patient. So that's the reason why when I quitted the healthcare advertising agency, I decided to work and to focus on preventive medicine. So as you said, Ioan, now I am, I hope, one of the experts in France on preventive or lifestyle medicine, and what I would like to be, what I hope, a kind of influencer. So I started a blog into 2017. I'm an author because I wrote 2 books on longevity. I am a radio host because I have a weekly chronicle on a national radio on longevity, and I am a university lecturer at the Medicine University of Lille, where I involved in the longevity certificate, and my topic is the centenarians, because I'm very fan about centenarians. And last but not least, I am the representative in France for ELMO. So the question is how to promote lifestyle medicine in France. And first, we have to consider what is and how works the system, the French healthcare system. So as you may know, we are considered in France to have one of the best system in the world because of our healthcare access, our medicine quality, and thanks to our social security system. But our system is mainly based on cure. And we have each year a very small budget dedicated to prevention. The only thing which is done by the government is to develop mass media health prevention marketing campaigns on nutrition, physical activities, addiction, so which is good, but there is very few initiatives to develop the skills of doctors on prevention. One of these initiatives, which maybe you have heard, is the sport on prescription, which was we start 5 years ago on the east of France, and which is now extended in all France. So that's a key key initiative on lifestyle medicine, but doctors don't know about focusing on prevention on lifestyle medicine. Why? Because there is no place at the university, so they do not learn what is the preventive medicine, and they are not paid for that. So they don't have time, and they don't want to spend time on lifestyle medicine because they don't know about this kind of medicine, but they don't have any time for that. So when you want to promote the lifestyle medicine in France, you have two options. First is to focus on medical doctors. And this is not what I decided, because I think it's the role of the government, the health minister, to promote it. It's the role of the private health insurance, and it should be the role of medical organization. And ELMO is doing its best to develop it, but there is a lot of things to do. So what I chose and what I decided is to focus on the public and on the patient to develop the behavior change. So how to motivate patients? This is not something very easy. So what I decided is to focus on one keyword, which is longevity. And because one of the question which is raised by many people is how to live a longer and better life. So as you know, 25% of our longevity is influenced by genetics, and the 75%, which is the rest, is influenced by environment and lifestyle. So we have in our hands the solution to live longer and to have a better life. So this is on what I focus on my different commitment. And I worked on a concept which I call déclic attitude. So how we can translate it in France, it could be the trigger to adopt the good health attitude. And each déclic I wrote and I promote was connected to an evidence. So each déclic promoted a lifestyle behavior based on scientific evidence. So for that, I organized my communication plan, if I can say like that, on 5 keys to aging well, 5 chapters or 5 categories of déclic. The first one is nutrition, the second one is physical activity, the third one is brain activity, the fourth social activity, and the fifth one is about sexuality. So the first thing I did, it was in 2017, was to launch my blog, which name is Déclic Attitude. And this blog was organized on the 5 categories I presented. And you have nutrition, activity physique, and all the other categories. In 2019, I released my first book, Le Grand Livre des Secrets de la Longévité, which is the great book, can be translated, the great book of the secrets of longevity. So a strong content to understand what is longevity, what do we know about scientific evidence, a strong focus on centenarians and the blue zone, because I'm very interested with that, and all the déclic for the 5 categories I present you. the following year, it was an update of the first book. It was a quite good success. So the reason why they asked me to develop this new book. And this year, so just to show you the content of this book is organized. So I'm sorry, it's not translated, but it's in French. For example, what is a déclic in the chapter physical activities? The first one is I adopt a dog. So why I adopt the dog? Because we have many studies that have been done by scientific about the benefit that having a dog could provide to patient. And of course, because you have an activity physique, whatever is the weather, it's raining or it's sunny, you have to go out to work with your dog, and you will gain 10 years on life lifespan. So and you will do 20% more activity physique than people who don't have dog. The second one is just an example. Is I take my bicycle to go to work, and why? Because I reduce by 41% the mortality in the study. So I'm each day working to identify the studies that show a link between a lifestyle behavior and a scientific benefit on longevity or mortality. Other examples just to show about the sedentarity, how to stop to look on to watch the TV more than 2 hours a day, because I will have a lot of inflammation and mortality which will be increased. I stop to spend many time on the screen because of the sedentarity, etc., etc. We have a lot of studies each day which are released on the lifestyle and the benefits on health and longevity. The same on nutrition, exactly. And this year, I started something which is very new for me, to work on a radio. It's a national radio, and I have a weekly chronicle on longevity. And that's very interesting, because for me, it's we have it's a 1 hour radio emission, and there is a personality which is invited, and I'm looking for to match with the personality and to find which is the best study on longevity that I can promote. So it's a lot of work to prepare it each week, but it's very interesting, and this chronicle has a big success because it creates a link between the personality and the scientific behavior. And next year, what's the book I'm working on, it will be again on longevity, and it will be on the centenarians, because as I told you, I'm very fan on and very interested in centenarians. And the pitch of the book is how to become a happy centenarian. Okay, so I have finished.
Thank you very much, Pascal, for this. And we had here even from Rachel that saying that my grandmother is a centenarian living in Ireland, so she celebrated her 100th birthday on 20th of March this year, and he's the first centenarian in her family tree, so you might like to interview her. So if you want,
yes, with pleasure.
I can put you in contact, because Rachel was a participant in the ELMO certificate. So now you have a bit of a feedback from your new work, as I would say, like in the radio. How is the feedback from people, the audience, when you talk about? lifestyle, about longevity, about healthy lifestyle?
Well, in France, we have a survey on centenarians, and 35% of people say they would like to be a centenarian, but the condition is they want to have an healthier life. So they don't want to lose their autonomy. They want to keep it. So I think in France, because France is the first European country for the number of centenarians, I think we have a pretty good image of what is centenarian, and people are proud when they have a centenarian in their relative. So I think longevity is something that interests people, but they don't want having a doctor telling them, you have to do that, you have to do that, you have to do that, you have to do that. So the approach and the way I'm doing it, it's just to say a little bit by a little bit. So that's the reason why I use this déclic, and just to convince a little by a little people to adopt one new behavior, but not more than one. And when you use a new one, then after you are more able to be convinced for a second one, and etc.
Thank you. So Maria Luisa Bali is saying that it's an excellent presentation, and indeed it shows what Beth Freitas was saying in the morning, that how important, or in the afternoon, how important is the creativity. So you choose the media tool to promote the healthy lifestyle. So really great.
I am a communication, I have this communication expertise, so I'm not practicing as a medical doctor. So that's the reason why I'm working beside and along the medical doctors to help them.
But anyway, we hope that your book will be translated in English, because it's really something very evidence-based. So I bought both of, even the updated version of your book, I bought both of them, and I can confirm that they are really each chapter with biography. So it's really a great book and useful book to read. So thank you for being present.
Thank you very much.
Thank you.
Bye-bye.